This is Dan Schuyler, Director with Leavitt Partners. Today I will be talking about health insurance exchanges. Most specifically, the topics I will be covering are the core components of an exchange, a point-of-sale portal, a true health insurance exchange, and the components of a PPACA compliant exchange. Let's first look at the core components of an exchange. Just like a car needs an engine, transmission, wheels, brakes, etc. to function, an exchange also needs specific components to function as well. These core functions are a portal or website, an enrollment interface, a plan comparison interface, an administration interface, and a communication interface. Let's first look at the portal or website. This is the main entry point for enrollees. It is simply the home page of the exchange website. Next, we have the enrollment interface. The enrollment technology facilitates the health plan enrollment using a uniform application. Enrollees or consumers complete an application to begin the enrollment process. Next, there is the plan comparison interface. The plan comparison technology provides the consumer with a side-by-side comparison of health plans. This also includes the consumer decision technology that will provide the consumer with intuitive tools to assist the consumer with choosing a plan that best fits their needs or the needs of their family. The plan comparison interface is one of the more critical components of an exchange. It must provide consumers with intuitive tools to make informed decisions. The next component is the administration interface. The administration interface is used to facilitate life events, admin updates, customer service, billing, etc. The administration interface also needs to be intuitive and simple to use and navigate. The administration interface can also be used by health plans to make changes to their current plans offered in the exchange. And finally, we have the communication interface. The communication interface facilitates the required communication of data between the exchange and the health plans. The next topic we're going to discuss is a point-of-sale portal. A point-of-sale portal is simply a tool that allows consumers to choose from a selection of health plans and begin the enrollment process. A point-of-sale portal has some of the core functions of a health exchange, but is also lacking many of the critical components of an exchange. A point-of-sale portal has a portal or website, an enrollment interface, and a plan comparison interface. However, in a point-of-sale portal, after the health plan is selected, all future transactions and interactions, enrollment, life events, customer service, etc., are handled directly between the consumer and the carrier. Now let's take a look at a true health insurance exchange. A true health insurance exchange has all of the core components mentioned earlier that are necessary for an exchange to function. A portal or website, an enrollment interface, a plan comparison interface with consumer decision support tools, an administration interface, and a communication interface. In a true exchange, the consumer enrolls in a health plan and then begins the plan selection process. Again, it's important that the exchange provides consumers with intuitive decision support tools to assist the consumers with choosing a plan that best fits their needs or the needs of their family. In addition, a true exchange provides the administration interface that we spoke about. In a true exchange, the employee, consumer, or employer utilizes the exchange for everything, including life events, customer service, billing, etc. A true exchange also has a communication interface. The communication interface is a critical component that provides necessary technology for an exchange to function. Before we move on, it's important to note that all the functionality and technology mentioned here is already available from several different technology vendors. So we have looked at a point-of-sale portal and a true exchange. Now let's look at the functions of an exchange as defined by the Affordable Care Act. Here we have an overview of a PPACA compliant exchange. As you can see, there are a lot more components and functions in an ACA exchange. Many of the functions we have already discussed. You have the portal or website, the plan comparison interface, the administration interface, and the communication interface. So let's take a look at some of the additional functions of an ACA exchange. An ACA exchange will be required to perform and send specific eligibility data to several different federal agencies. There will be income and tax credit eligibility and verification with the IRS. There will be subsidy eligibility and verification with the Treasury Department. There will be citizenship and residency verification requirements with Homeland Security and Social Security. And there will also be reporting requirements with HHS. Let's take a look at the Data Services Hub. In June of this year, HHS provided some insight regarding the proposed Data Services Hub. To ensure reliable, standardized service to exchanges, Medicaid, and programs, and in recognition that it is inefficient for a state exchange to organize a multitude of point-to-point interfaces for the exchange of data, HHS will establish a Data Services Hub. The Data Services Hub can play a role in reducing costs and improving reliability by organizing other interfaces that would otherwise require a multitude of point-to-point interfaces and redundancies. It is anticipated that HHS will provide a set of data standards and protocols for states to be able to share data with the Data Services Hub. Next, we have the online calculator. The online calculator will help consumers to determine the actual cost of coverage after application of tax credits and cost sharing. An ACA-compliant exchange will also have to certify, recertify, and decertify health plans. This most likely will be a collaborative process with the state's insurance department or agency. Another function of the ACA exchange will be the risk adjustment mechanism. This most likely will be performed by a third-party administrator or could be handled by a financial services entity. Either way, risk adjustment will be a critical component to any exchange. As you can see, an ACA-compliant exchange has many moving pieces and will require unique technologies to facilitate several of the components. While many of the technologies currently exist, it is our belief that not one single technology vendor will be able to provide all the required components of an ACA exchange. To build an ACA exchange will require a collaborative partnership of 2 or more technology vendors. Well, I hope you found this presentation informative. We covered a lot of information in this presentation, so if you have any questions, please feel free to send me an email at dan.schuyler@leavittpartners.com, or you can leave a comment or question down below. Please check back for additional information about health insurance exchanges.